No, in fact, the masking is a critical defense against the Delta variant. You know, the idea of masking and social distancing is to prevent the spread of the coronavirus responsible for COVID-19. Well, the Delta variant is twice as infectious as the original variant of COVID-19 that we've been dealing with. So the idea that masking doesn't work against the Delta variant or is not a good idea in the current circumstances that we face is utterly preposterous. And frankly, it's one of the reasons why the southern states and the Appalachian states are showing the highest prevalence of the outbreaks of the Delta strain, is because vaccination rates are low there and compliance is low there. And it is absolutely unforgivable that the leaders of these states are helping to propagate this misinformation. And I'm not talking about the gravity of the disease. In fact, from what we understand, the Delta variant is no more dangerous in terms of actual mortality or morbidity than the original variants that we've been dealing with. But it's about the ability to pass from person to person. So let me give you an example. The older variant, if I had it and I wasn't masking and I wasn't doing social distancing and I walked into a room filled with people, before I left that room, 2.5 of those 2.5 people would now also have COVID-19. Now the Delta variant is the leading version of this virus. Me walking into that same room, again, not masking, and again, not practicing social distancing, before I left that room, 4 new people would be infected with it. And that's one of the challenges of this and why the CDC has been forced to revise their recommendations, because of the infectivity of the Delta variant. Well, let's be clear about something. Even the older variant could still be infected, could infect someone who had been vaccinated with either the Moderna or the Pfizer vaccines. And now what we're seeing, I just had 2 patients last weekend go to some sort of a communal gathering, and they both came home with COVID-19. Both of them had the Pfizer vaccine. All we're hearing now is more cases of what we call breakthrough cases, because the Delta variant is more infectious. But even with the older Alpha variant, it was happening. But the good news for those of us who've been vaccinated is that while we're still passing it on and therefore pose an epidemiologic threat to the community, the infection itself, thanks to the fact that we've been vaccinated, will not likely result in us being hospitalized and will not result in death. In fact, Pfizer is maintaining about a 97% efficacy in keeping those of us who've been vaccinated with the Pfizer vaccine from ever being hospitalized, even with what we call a breakthrough infection. That's an infection with COVID after being vaccinated. Because we live in an age of ignorance and polarization. That is the only reason why we're not able to do that. We have the technology, we can get the logistical support that we need to get through any bottlenecks, and we've got the money to do it. Westernized, industrialized, first world countries can see the greater picture and the greater good in doing this. I think they're able to do it. But what we can't seem to overcome is the self-inflicted wounds of ignorance that I believe are being propagated by social media and this age of technology and digitalization that allows those amongst us who are ignorant to find fellow idiots that then become echo chambers, and they propagate half-truths and misinformation that is confusing the populace and making so many people that should just be getting the vaccine not actually getting the vaccine through choice. That's the unforgivable part of all of this, is that these are self-inflicted wounds. The perpetuation of this pandemic is something that we as human beings are choosing to do.